Okay, so it is the end of the year. So we're goal setting, resolutions, all that kind of stuff. So one thing that I want to bring to your attention that you probably haven't thought of a whole lot yet is how to optimize your child's health in 2025. So gone are the days where parents have to settle for a one-size-fits-all care model. God designed us all uniquely, individually, and very intentionally unique. So everyone's health care should also be followed this way. There is not a one-size-fits-all for me versus a kiddo who's 8 who is having sensory processing challenges. So that's how our healthcare should be viewed. So going into 2025, there are providers out there that are making parents feel heard, feel seen, who have an overall approach, so they're willing to work with other providers. So the green flags that you should look for in your child's healthcare provider in 2025 is they seek root causes, they understand neurodevelopment, they have collaboration with other providers, and they partner with parents most importantly. So doctors who seek finding root causes is a little unique because in the traditional healthcare model, there's kind of a dictatorship care approach. There's a one-size-fits-all, and it leaves parents feeling lost, unheard, and unseen when it comes to their children. As pediatric neurologically focused chiropractors, we focus on finding the root cause, and some of the root causes of why your child can be experiencing some of the things that you are seeing them struggle with are things like there was a lot of stress and maternal distress during pregnancy. There were birth interventions used such as C-section, forceps, and vacuum extractions. Early childhood stressors like colic and reflux and recurrent ear infections. Overuse and misuse of antibiotics. And environmental toxicity, so things such as pollutants, cigarette smoke, and any highly processed food diet, all sorts of different toxins that exist in our day-to-day lives. Now, this is something that we as PX doctors call the perfect storm. There is not one isolated event that has caused the challenges that your child goes through, but it's more of a storm is what we call it. So there's a combination of those early life stressors that are leading up to these things. So having a doctor who understands neurodevelopment is huge. This is not like a traditional medical pediatrician that focuses on treating symptoms and diagnosing things and managing it with medication, kind of suppressing the nervous system from functioning as it's meant to or disguising symptoms. So rather referring to the growth chart that your pediatrician will show you with percentages, as pediatric chiropractors, we are more passionate about hearing your story and tying it to your child's individual needs. So the nervous system is the boss of the body, right? It controls absolutely everything, such as the digestive process, so motility, absorption, and elimination, immune system regulation, and emotional and cognitive development are huge, which is something the nervous system is in complete control over. And if that's thrown off course, or if it's struggling, child is not digesting food properly, or they're getting sick all the time, or they can't sit still in school because they can't focus, or they can't wear certain clothes because it feels wrong. All these things. If we fix the nervous system first, finding that root cause, we can heal the body from within, and we can live as God intended us to. So some of these things that have been caused by these early stressors that I mentioned earlier, like the birth interventions and the toxins, can lead to two different things within the nervous system, and they're called subluxation and dysautonomia. So subluxation is a disrupted proper communication between the brain and the body. When there's subluxation going on, the body cannot regulate like it's meant to, which leads to dysautonomia. Dysautonomia is an imbalance within your autonomic nervous system. Your autonomic nervous system is in control of things like your heartbeat and your digestion and your breathing and your hormonal regulation. So if there's an imbalance in that, that's why you're seeing some of these things in your child. So when both of these are existing in your children's nervous system, that can lead to the wide range of things that we see in kids today, like autism and ADHD and sensory processing, constipation, gluten and casein intolerance. Like there is such a wide variety of subluxation and dysautonomia causing what we're seeing in kids today. So having a doctor who is open-minded is completely, utterly invaluable. So the benefit to having a collaborative team-based approach is there are multiple eyes watching your children's health. We are meant as healthcare providers to work as a team, to be integrated, because each profession has something different they can bring to the table when it comes to your child's health. Like PTs have a big role in gross motor development. Occupational therapists are more the handwriting, sensory, fine motor skills a child could be struggling with. Speech and language, pretty self-explanatory if your child's having a problem with speech, but also feeding therapies is another thing they're highly trained on. And then integrated and holistic pediatricians who look more for holistic natural remedies before pushing medication is huge. And then nutritionists who can help supplement your child if they are struggling. All of these providers are meant to work together and collaborate and be a team. So in a team-based approach, the doctor often serves as the quarterback to the rest of the team. It coordinates care, facilitating communication among all these providers, and the role is crucial for ensuring that your child is functioning as they're meant to. And everyone's working to the same goal. Everybody's communicating so they can know where they can step in to assist. However, in today's day and age, many healthcare providers work as silos instead of a team. So they focus solely on the area, thinking that is all that is needed to be done. When in reality, there's a bigger picture to your child's health. So our goal here at our office is to make parents feel seen, feel heard, and provide hope, help, and drug-free answers, and empower you with the knowledge to take control of your child's health. So we as PX doctors address things like birth trauma and environmental stressors and nutritional imbalances here in the office and see how that's affecting your child's nervous system. On top of that, how we approach care is we do an in-depth consultation. Your child has a unique story, so that's what we look at, from how was pregnancy, how was the birth process, what other early stressors did they have, and how we measure that. Subluxation and dysautonomia I mentioned earlier is through our insight scans. They are state-of-the-art scans that assess how your child's nervous system is doing. And then finally, your child gets a personalized care plan. It's personal to their needs. It's personal to their story. Your child gets a personalized care plan tailored to their story and their specific needs. So it helps your child get to the point where they are living as they are meant to, and you are seeing your child thrive in their health. So 2025 is supposed to be an awesome, incredible year that your child is meant to thrive and grow and be the most awesome kid that there ever was. So if you have any further questions, there's more information linked down below. Otherwise, have a wonderful rest of your day, and we hope to hear from you soon.